His money would buy 15,000 vaccines, of which 5,000 would be for his tenants and employees. To speak to us about this and more, we have Ms. Elena Kembabazi, the Program Manager, Right to Health at the Initiative for Social and Economic Rights. A very good afternoon, Elena, and thank you for joining us. What is your comment on the contention and dispute of the facts between government and HAM, and what could be the likely implication of this? Elena Kembabazi, if you can hear me, what could be the likely implication of this issue to this country?
Disappointing for those of us who have been shouting about vaccine equity. I mean, you get up and in a time of vaccine scarcity,
Yes.
you're using donations, you give 2,000 doses to one person. And then you come and tell us, after you've done the deed, after it has been leaked to the media, that this was because people were not coming. You're the same government that locked us down. You're the same government that is supposed to make sure people can access vaccines within walking distance. I have been trying to get an 8-year-old a second dose, and I'm not getting it. And then you hear a private, like a businessman who donated money got 2,000 doses. You have locked Ugandans up, and you've said we have to be vaccinated before we come out. And here you are giving it to non-priority groups. The ministry sets up the priority groups, and then it violates its own criteria. Can you then blame Ugandans who go do private vaccination drives? Can you then blame those who go and give out water? After all, for you, you're taking the exercise not seriously.
Yes.
I think all Ugandans should demand for accountability. This is completely unacceptable.
Elena Kembabazi, where does this leave us as a country in a situation whereby a businessman, a private businessman, can have access to these scarce vaccines when Ugandans are grappling? Where does this leave us as a country?
Exactly. We are entrenching the few elite. It's a country of those who have money and connections. It means that poor people, older persons in rural areas, even here in the city, like the 8-year-old I was talking about, are unable to get vaccines, and you're giving it to the highest bidder. Yet these are donations. These are vaccines that later on are even going to be procured by government money. So what do you say? What do you communicate to Ugandans when you do this? We need an inquiry. Parliament must take it seriously. And when did Hamis Chigundu suddenly become the mobilizer extraordinaire of people who need vaccination? What does this mean about COVID preparation as a whole? It just reflects the fact that as a country, we have decided to prioritize those who have elite and resources. We see it whether it's access to oxygen or ICU, and now even COVID vaccine. So where does that leave the poor person in Uganda? Whose country is this? We need to get serious. COVID vaccines should be available to everyone. And when they're scarce right now, they should be given out on priority, according to the plan, in a transparent manner. Not in these back behind the door deals that then come out and you start saying people are lying. Ugandans have already made up their minds that you are failing them in this regard. And if we continue to see this, a lot of us are going to take legal action. It's discrimination.
All right, thank you very much, Ms. Elena Kembabazi. She is the Program Manager, Right to Health at the Initiative for Social and Economic Rights. Many thanks.